Somaliland is located in the Horn of East Africa. This country still bears the physical and mental scars caused by a savage civil war 25 years ago. Stricken with limited resources and restricted assistance from the outside world, this unrecognised state suffers from poor health, education and economic development. The majority of the people in Somaliland live in dire poverty and battle with post-war depression, high unemployment, lack of basic services and recurrent droughts due to the climate change. The stress of daily life has caused a drastic increase in mental illness among the Somaliland population. Dr. Abdirahman, who is a mental illness doctor in Somaliland, states that mental illness is extremely high in Somaliland. He says, I would say it has to be of one of the highest rates in the world. Before the Civil War, people lived normal lives. Many were working, studying, or were married. But after the war, they lost everything. The short film explores the plight of those living with mental illness in Somaliland. Two members of the Somaliland Mental Health Organisation, Mr. Nasser Isa, who is the chairman, and Mr. Adam Yusuf, who is the treasurer, travelled to Somaliland in the summer of 2014 in order to document and highlight the needs of those suffering from mental health in Somaliland. They were overwhelmed by the inadequate services provided and the extremely poor condition many were living in. One of the cities in Borome City and the psychiatrist unit, they were met by a Dr. Abdirahman Haji Ali, who has been running this unit since it became operational 3 years ago. Dr. Abdirahman states this unit has been open for 3 years, and now this is the only hospital that cares for mental health patients in the entire city. Dr. Abdirahman explains the pressure they are under. With limited space, manpower and medication, they are incapable of reaching out to those that need it most. He says they currently treat about 500 patients in and around Borome. There are outpatients like Mumin, who has been receiving treatment for the last 2 months. His condition has improved dramatically, and he thanks the doctors and the nurses for taking good care of him. Mumin Mohammed states, I have been in hospital for 2 months now. Before I came in, I was very sick. I used to run away. I was very aggressive. But after being taken in by this hospital and given medication, I am now very calm. I am extremely happy. The staff have looked after me very well, and they gave me clothes, and I would like to thank them dearly. Mumin Dahir is a mother of 5, and 4 of them suffer from mental illness. Her situation is dire. She has no access to medical care for her children and has no family support whatsoever. Mumin Dahir states, I can barely afford food, let alone medication, for all of them. All 4 of my children are ill. I have no strength. I have no will to carry on. Ahmed O. Aden is suffering from post-traumatic depression. After the war, he has been chained in his home for more than 20 years and as a result is unable to walk. This young man has been sick for many years now. He has no one to care for him and has been locked up in chains, unable to walk or even go to the toilet. There are many people like Ahmed who desperately need our help before it is too late. Amina has 3 siblings, all of which suffer from a mental illness. Thankfully, nurses from Mandaya Hospital take medication to her home and conduct regular checkups. Amina Heibi states, I have 3 siblings. One is 18 years of age. The others are 22 and 24 years of age. 2 of them have been sick for 13 years and the other has been sick for 3 years. It is difficult to express the pain and hardship that people with mental illness go through. There is an extreme need in providing medication and sufficient health care. That is why Somaliland Mental Health Support is trying to reach those that are hardest hit. The people of Somaliland need your help.